Welcome to Self Empowerment. Knowledge empowers us to make appropriate decisions. Patients and their relatives come to family physicians with innumerable different FAQs. Here at Self Empowerment, we analyze and explain the question and empower you to make your own decision. So let us face today's not so uncommon scenario. Patient says, Doctor, I was feeling very weak. I have been given an IV drip for the weakness at a clinic near my house. Or, Doctor, I am feeling very weak since some time. Please give me a saline drip. There are two questions to consider here. Number one, what are the causes of feeling weak? And number two, in what situations is IV drip ideally given? So, what are the causes of feeling weak? Number one, poor sleep. Poor sleep can make a person feel weak. This weakness will not go away with IV fluids. The person needs to have adequate, good sleep to feel better. Weakness can be caused by deficiency of vitamins, minerals, and other nutrients. And this needs to be taken care of by appropriate foods and supplements if required. Dehydration. If dehydration is associated with inability to take fluids orally, as in persistent vomiting, then IV fluids need to be given. If the person is able to take oral fluids, then dehydration is treated by giving oral fluids and not by IV fluids. Sedentary lifestyle can make a person feel weak, and to address this, the person needs to get physically active. Number 5, excess physical activity or overexertion can also lead to feeling weak, and the person needs to take adequate rest to feel better. Stress and burnout can cause weakness, and the person needs to learn to manage stress or get out of the situation causing stress. IV fluids will not make you feel better in this condition. Excess caffeine and alcohol can cause weakness, and its intake has to be curbed to feel better. Anemia, that is low hemoglobin levels, can make a person feel weak. This has to be corrected by correct nutrition and supplements as advised by a doctor. IV fluids will not treat anemia. Thyroid illnesses causing weakness are treated by medication. Diabetes or blood sugar imbalances can make a person feel weak, and they have to be managed by lifestyle modifications and, if required, medications. Infections are a major source of causing weakness. They are treated by anti-infective agents like antibiotics, antivirals, etc. IV fluids cannot cure infections. Heart, lung, kidney, liver, or other organ disease can make a person feel very weak. They need to be investigated and treated accordingly. Some medicines can make a person feel weak if they are for a short duration. Once they are stopped, the weakness will go away. However, if they are required to be taken for a longer duration, One can ask the doctor if there is an alternative or how to deal with the weakness. So, when is an IV drip ideally given? There are 5 situations listed here. Number 1, fluid resuscitation. That is, if the fluid in the body is lost, as in trauma, where there is severe blood loss, or loss of fluid due to dehydration caused by persistent vomiting or diarrhea, or the person has gone into shock, that is, blood pressure has become very low. In these situations, IV fluid has to be given to replenish the fluids. Maintenance and replacement therapy. When a patient cannot eat or drink, which can happen in many situations, the daily water and electrolytes need to be replenished and they are given by IV fluids. Medication administration. Certain drugs cannot be taken orally and they have to be delivered by IV fluids. Sometimes a drug needs to be given in a very precise continuous dose. In such a situation, it is given by IV route because orally taken medication, the absorption can be erratic depending on presence of food and many other factors. Blood transfusions have to be given by IV route when there is severe anemia. Mild anemia does not need to be treated by blood transfusion. Or if there has been blood loss following trauma, and certain bleeding disorders like thalassemia, hemophilia, blood transfusions are given. Nutritional support to patients who cannot absorb nutrients through gastrointestinal tract. The food that we take orally is absorbed through the intestines. In certain illnesses, the intestines stop absorbing the nutrients, in which case the nutrition has to be given by intravenous fluids. Hence, when you are feeling weak, find the cause of the weakness. Treat the cause. If the cause fits into the situation for taking IV fluids, then you may opt for it. Remember, IV fluids are not a treatment for weakness. So, will it harm if IV fluids are taken even when not required to be taken? Yes, it may. This can cause electrolyte disturbances and other complications in the body. This can also cause infection in the body. So, with this knowledge, you are now empowered to decide for yourself whether you should be taking an IV drip when you are feeling weak. Please post your questions in the comment section, and if this video has empowered you, please like and share the video. Your questions in the comment section will be the source of the next episode of Self-Empowerment. Empower yourself. Thank you.